Hi everybody, this is Mary. I've had my psych evaluation today, so this is my third pre-op update. I met with the psych after I did the test and the evaluation, and she rather surprised me by telling me that according to the test I was clinically depressed and almost clinically suicidal. I couldn't figure out what on earth she was talking about. In fact, I feel better about my life now than I have in a long time. So we talked a little bit, and I said, well, what on earth would the test, about the test would say that I was suicidal? I said, I can't believe that. And she said, well, it was this question here, and there's one question. And it was something about, are you thinking more about the end of life and the ramifications of death, or something like that? And I had answered it yes. And she said, well, it was this question, and read it to me. And I said, well, the reason I answered that yes is because my dad's got bone cancer and probably isn't going to live beyond the next couple of years. So I've been thinking about that a lot. I said, but I don't think that makes me suicidal. And then she was quizzing me about some of the other things that were showing up on the test. For example, I seem to have more symptoms of pain than normal pre-surgery patients did. And I said, well, I didn't know how to answer that. I knew it was a psych evaluation, but when it asked me if I have headaches, I have headaches. I know that they're related to my chronic sinus infections, but I wasn't sure. Should I lie and say I don't have them? I said I didn't know how to deal with that question. So she kind of let that go, and finally she said, well, I think we're going to need to do a couple counseling sessions before we can approve you for surgery, and maybe one after surgery. And I said, okay, that's fine, whatever it takes to get to where I want to go. And so she started talking about how I should go about setting up the appointments and how much time it might take. And I asked her if she thought that I could get a couple appointments in within the next couple months, because that's when my last two dietitian visits would be done. And she said, well, she thought I could, and she talked to me a bit more, said that one of the things that bothered her was that I didn't seem to know all the possible side effects of surgery. I mean, I listed band slippage, I listed band erosion, I said that you might, not follow the plan and eat yourself out of it. I said they might nick something that they're not supposed to during surgery. You might have infections at the wound sites. But she didn't seem to think that was enough. I should have known more possible side effects. So would I be willing to go back and read about those side effects? And I said, if that's what it takes, certainly that's what I'm willing to do. And then all of a sudden she said, do you think you're having good luck with your dietitian changing some of your eating habits? And I said, well, I'm having surprisingly good luck. I've lost 16 pounds already, and we've been making a lot of the changes that I needed to do post-surgery. We had started doing already. Then all of a sudden she says, well, how about this? How about if I recommend you for surgery and you agree to come and see me 3 months post-surgery? Excuse me. And I said, certainly I'll agree to do that. Anything, And so that's what our plan is. She's going to give them a thumbs up so I can move forward. And I just have to, when I come in for my first checkup after surgery, I'm supposed to tell them that she wants me to do one counseling session afterwards, and would they please refer me to her. So that hurdle is done. Now I'll go to the doctor's where they sit down and evaluate the potential patients and decide what other tests they want me to have, and from there set a surgery date. So I'm one step closer to joining you all on the weight loss bench. I'm pretty excited about that. I don't know if you can see or not, I have a little extra equipment on my arm. This Saturday I was out skiing with my husband and my daughter-in-law and my 2 boys, and we decided to do a chairlift that we hadn't been riding on because the one we had been riding on was having mechanical problems. So we scooted over to the other chairlift, and somehow in the mix-up, instead of riding up with one of my boys, my husband and I ended up riding up with a stranger who was on the left-hand side. There was a stranger, my husband, and then me on the lift. And we got to the point where we were supposed to disembark. It was a bit of a hill where you disembark, but for some reason this blankety-blank moron, instead of going left where all the ski hills are, instead of going straight, for some reason he went right in front of my husband, right across my skis, and stopped me dead in my tracks. I went flying forward right on my face. I got a cut lip out of it where my teeth punctured my lip, but worse than that, I have a dislocated shoulder and a fractured humerus bone. Apparently the top of the humerus bone, where it's all kind of bulby, my husband says where the milk biscuit part is, I fractured one of those parts of the bulb right off. Right now the doctor's got me in this immobilizer, and we're going to wait until the 25th and see if that part that he popped back in when he reduced the arm for the dislocation, if it's staying in place. If it stays in place, he says it will heal in place and not give me any trouble. But if it seems like it's moving at all, they're going to have to do surgery and have it pinned in place. So next Wednesday on the 25th, I'll find out whether I'm going to have surgery for that. I have my fingers crossed that I won't need it. It was, I have to say, one of the more painful things I've been through.